Right, my name is Najib. I'm one of the trustees of Doctors Worldwide. We're here in our office, and I just wanted to explain a little bit about our Rohingya response plan. I was in Burma earlier this year and also in Bangladesh not so long ago. We've sent some further volunteer teams as well, and we're working on our response. One of the biggest challenges out there is the lack of qualified human resource. This fits with the sphere standards, the second sphere standard. So if you look at humanitarian principles, one of the key things are having an adequately trained and skilled workforce to deliver your work. And in most of the partner organizations that we visited, there aren't any. They're either depending on volunteers from outside outside Bangladesh, and clearly that isn't sustainable. And the local workforce just isn't skilled up yet to deal with the tragedy of that Rohingya refugee crisis. So this is what our program is going to try and do. We've got a pool of local Bangladeshi doctors from local partner organizations, and we will hopefully have them deployed and employed through local partner organizations within the Rohingya refugee camps. But how we're going to support them, we're actually going to create a training syllabus over 2 months to cover some key critical content things around humanitarian principles, management of those that are critically sick, establishing triage within those clinics, getting them up to speed and up to date on how to manage specific critical illnesses such as diphtheria, cholera, malaria. That poor population, they haven't had any immunization for the past 30, 40 years while they've been in Burma. So when they're coming across now, living in really cramped conditions, certain diseases that we've never heard of are now running rampant. So diphtheria is already, there's outbreaks there, measles, there's an outbreak there. Just you wait, meningitis will probably kick on fairly quickly, as would some kind of dysentery. So local doctors have never dealt with this in a refugee setting, and we need to try and help skill them up to manage with that. And we'll also try and cover some stuff around mental health and depression. So how is that going to be delivered? Well, we're going to have volunteers from the UK, from other countries, that will be helping to teach some of that content, but also to supervise and monitor how well those local doctors are performing. So they can submit those cases, have them reviewed, sign them off to make sure that these doctors are fulfilling some basic requirements. And how are we going to measure all this? How do we know that this education actually makes a difference? Well, this is about standards of care. We want to make sure that every clinic that we're working in has triage, which means that those patients that are most critically sick and need the most care, they get seen first and prioritized. That isn't happening in most of the clinics. Another really important thing is that there's a maximum of 50 patients being seen per doctor per day. And you might say, well, that's not much. Well, actually, that's a huge amount. There's some in these clinics are seeing 300 patients a day with one doctor. So you can imagine what the quality of care is. So how is this all going to work? Well, there's some key outcomes I just want to quickly mention to you. How are we going to measure success of this program? One of the first things is that every clinic is going to have triage systems in place. So this is recognizing who are the most sick and are they prioritized in terms of when they're seen by a doctor and a healthcare worker. Another really important thing is about the maximum number of patients that a doctor will see. So you want to make sure that doctors are seeing a maximum of 50 patients per day. You might say, well, why 50? There's some clinics that are seeing 200, 300 per doctor. That's not good care. We know that what's happening then is that they just ask the patient what is their main complaint and dish them out with some medicines. In that way, you don't identify who's really sick. You don't identify who needs to be referred for specialist care. You don't identify those that are at risk of outbreaks and illness. You're sometimes giving the wrong medication for the wrong complaint. As a doctor, I know you need to take a history to understand what's wrong with the patient and do an examination. And you can only do that if you can limit the number of patients the doctor sees. If there's more patients coming, we need to then recruit more staff. So that's a very important standard for us to try and achieve at the end of this 6-month program. And we also want to have improved outbreak alert mechanisms, because we know that infectious diseases are at high risk of spreading. We need to have a good system in each of these facilities that we're supporting to make sure they've got a good outbreak alert system. So that's the program in a nutshell. So it's a training-based program because this has been an identified gap based on our assessments on the field. We're going to link with local partners and build their capacity. So we're going to take local physicians, help train them, get them deployed at local facilities to improve standards of care. The role for expatriate volunteers is to help with development of teaching materials and deliver the teaching and supervision required. And then we'll hopefully improve standards of care by improving triage, outbreak, alert systems, and the numbers of patients seen. How much is it all going to cost and what do we need to do it? Well, at the moment, our budgets, if we're just looking at operational costs for teaching materials, and to get some program management staff to help deliver this, we're looking at about £50,000 is what we need. If we want to kind of grow this and actually do a lot more, obviously the more we have, the more we can expand and scale up. And this would be for a 6-month program, and hoping to train 60 doctors in that process. So you can then imagine that's the direct beneficiaries, 60 doctors, each of those doctors seeing 50 patients each minimum per day for 6 months. You can do the math. Indirectly, each of those facilities are probably caring for a population of about 20,000 people. So our indirect beneficiaries are going to be around the scale of 50 to 100,000 beneficiaries. So a very high value, high impactful project. Rather than causing harm by performing bad medical practice, we're going to improve that and have a good impact for those people. And so we need to recruit a project manager, field coordinators, and technical support. And the work is ongoing. We've been working on this for the past few weeks. Help us to accelerate it. You can donate at WorldWide/donate, and obviously send checks through to the office. And by all means, write to us to get to know more about what exactly we're doing for this project. Thank you for your support.